I want you to do something right now before we go any further. Take off your shoes. Seriously. If you can, just slip them off and look at your feet. Because what I'm about to show you in the next few minutes might completely change the way you see them. Not as just the things that carry you around, but as one of the most accurate early warning systems your body has ever been given. Here's what most people don't know. Diabetes doesn't usually announce itself with dramatic symptoms. No alarm goes off. No pain that sends you rushing to the emergency room. Instead, it whispers, quietly, for years. And almost every single time, it whispers first through your feet. I'm Dr. Joseph Lee, and in over 2 decades of working with patients over 60, I've seen this pattern repeat itself more times than I can count. People who had no idea their blood sugar had been slowly climbing for years. People who felt fine. People who had annual checkups. And yet the signs were already there, written clearly on their feet, if only someone had known how to read them. Today, I'm going to teach you how to read them. 9 signs. Some will surprise you. Some you might already have and have been brushing off as nothing. And one of them, I'll tell you which one when we get there, is so commonly misunderstood that it causes people to wait years longer than they should before getting help. References are in the description below. You can check the sources there whenever you wish, because I'm not asking you to blindly trust my words. I'm asking you to verify the science for yourself. Before we begin, I have a question for you. What country are you watching from right now? Drop it in the comments below. And has anyone in your family been diagnosed with diabetes? Or have you been noticing changes in your feet that concern you? Tell me about it. I read every single comment and I respond to as many as I can. You are not just a number to me. Now, let's talk about your feet. Here's something the medical system doesn't do a great job of explaining. By the time type 2 diabetes shows up on a standard fasting blood sugar test, the damage has often been building for anywhere from 5 to 10 years. A decade, sometimes longer. The cells in your body have been quietly struggling with insulin resistance. The tiny blood vessels feeding your organs have been under stress. And the nerves that run all the way down to your toes, the longest nerves in your entire body, have already begun to feel the strain. The feet are the first place this shows up, every time. And the reason is simple biology. Your feet are the farthest point from your heart. They're at the end of the longest circulation routes in your body. They depend on thousands of microscopic blood vessels and nerve endings that are extraordinarily sensitive to even small changes in blood sugar. When blood sugar starts running even slightly higher than it should, not diabetic yet, just elevated, those tiny vessels start to change. Those nerve endings start to misfire. The American Diabetes Association estimates that around 1 in 5 people living with diabetes right now don't know they have it. That's more than 8 million people walking around with a condition that's silently damaging their kidneys, their eyes, their heart, and their feet without any idea. That number doesn't have to include you. So let's go through each sign one by one. I'll tell you what it looks like, what most people assume it is, what's actually happening inside your body, and what you should do if you recognize it. Sign number 1, tingling or pins and needles that keeps coming back. Almost every patient I've ever seen with early diabetic nerve damage described this the same way. They said their foot just falls asleep sometimes. They cross their legs for a few minutes, feel the familiar pins and needles, and think nothing of it. But here's the question I always ask them. Is it happening without a clear reason? When you haven't been sitting in an awkward position? When you've been perfectly still in bed? Because occasional tingling from pressure is completely normal. But tingling that comes back on its own, without explanation, and especially in both feet, that's your nervous system sending up a signal flare. What's happening underneath is this. High blood sugar acts like a slow acid on the protective coating around your nerves. That coating is called the myelin sheath. Think of it like the plastic insulation around an electrical wire. When it's intact, signals travel cleanly and clearly. When it starts to break down, signals get fuzzy. They misfire, they leak. And that leaking is what you feel as tingling. This condition has a medical name, peripheral neuropathy. And according to the American Diabetes Association, It affects nearly half of all people with diabetes. Half. And in almost every case, it starts in the feet. The daily habit I recommend starting right now is simple. A 20 to 30 minute walk every morning. Not a jog, a walk. Movement keeps blood flowing to those nerve endings and slows the damage significantly. And begin reducing added sugar today, not next week, not after the holidays, today. Sign number 2, a burning feeling on the soles of your feet, especially at night. This is the one that keeps people awake at 2 in the morning staring at the ceiling. And it's almost always dismissed. Patients tell me they wore the wrong shoes, or they were on their feet too long, or it's just getting older. But burning in the soles of your feet, particularly when you're lying down with nothing touching them, is one of the most classic early signs of diabetic nerve damage that exists. And the reason it gets worse at night is important. During the day, your brain is flooded with sensory information from everywhere. You're moving, you're processing sounds, sights, conversations. The burning is still there, but it gets drowned out. At night, when the room goes quiet and there's nothing to distract you, that signal from your damaged nerves becomes the loudest thing in the room. Here's what's actually happening inside your feet. The nerve endings have been damaged by excess sugar, and they're sending random, incorrect signals to your brain. Your brain receives a heat message even though nothing hot is touching your skin. The nerve is broken, not your foot. Research published in the journal Diabetes Care found that burning foot pain is one of the first symptoms reported in patients later diagnosed with type 2 diabetes, often appearing 1 to 3 years before a formal diagnosis. Years earlier. 2 things I want you to start doing. Drink at least 8 glasses of water throughout the day. Proper hydration helps your kidneys flush excess glucose, and it supports nerve tissue directly. And add more fiber to every meal. Vegetables, oats, legumes. Fiber slows sugar absorption, which is exactly what your nerves are begging for. Sign number 3, a small wound or blister that takes weeks to heal. This is the sign that moves people from uncomfortable to genuinely dangerous territory. And I need you to hear this one carefully. When blood sugar stays elevated, even at levels your doctor might call borderline, the tiny blood vessels throughout your body begin to narrow and stiffen. The ones in your feet are affected first because they're the smallest and the most distant from your heart. What that means practically is this. When you get a small cut on your foot, the oxygen, the white blood cells, and the nutrients your body needs to repair that wound simply cannot get there fast enough. They're stuck in narrow, stiffened pipes. The wound sits open. Bacteria move in. And what started as something you could barely see becomes a serious infection. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Over 100,000 every year. And almost all of them started as something small that someone ignored. I'm not sharing that to frighten you. I'm sharing it because knowing this changes behavior. Tonight, after your bath or shower, sit down in good light and look at both feet carefully. Look between every single toe. Look at your heels. If you see anything, a blister, a cut, any broken skin, clean it gently, apply antiseptic, and cover it. And if it hasn't improved within 48 hours, call your doctor. Not next week, 48 hours. Sign number 4, unusual skin darkening or discoloration around the ankles. This one is hiding in plain sight on millions of feet right now. And people almost never connect it to blood sugar because it doesn't hurt and it doesn't look alarming at first glance. What you might notice is a darkening of the skin around your lower legs and ankles. Sometimes a deep reddish tone, sometimes a slightly bluish tint. The skin in that area might look different from the rest of your leg, thinner perhaps, more fragile. Here's what that discoloration is telling you. When circulation is compromised by elevated blood sugar, the blood vessels feeding your lower legs begin to struggle. Freshly oxygenated blood isn't arriving the way it should. The skin, starved of proper circulation, changes color. It's sending a visible distress signal. A study published in the Journal of the American Academy of Dermatology found that these kinds of skin changes in the lower extremities are detectable on average 18 months before a formal diabetes diagnosis, a year and a half, sitting right there on someone's legs while they go about their daily life, completely unaware. The daily habit here is one of the simplest things I ever recommend. 5 minutes of ankle circles, toe raises, and calf stretches every morning before you stand up. Even that small amount of movement pushes blood through those lower vessels. And if you spend a lot of time sitting, try elevating your feet slightly on a footstool. It makes a genuine, measurable difference. Sign number 5, cracked heels that no amount of moisturizer seems to fix. I know, it sounds like a skin problem. It looks like a skin problem. And almost everyone who comes to me with severe heel cracking has been treating it like a skin problem for months, sometimes years, buying creams and lotions and hoping it gets better. But here's what's actually happening. Diabetes damages what are called the autonomic nerves, the nerves that control your body's automatic functions. One of those functions is the regulation of moisture and sweat in the skin of your feet. When these autonomic nerves are damaged, the sweat glands in your feet stop working properly. Your feet lose their natural moisture from the inside, not from the surface down, from the inside out. No lotion addresses that root cause. The skin dries and cracks because it's being starved of moisture at the source. The American Podiatric Medical Association identifies persistent, hard-to-treat heel cracking as a significant indicator of autonomic neuropathy in seniors, a condition directly linked to long-term elevated blood sugar. 2 things. First, moisturize your feet every single night before bed. A good, unscented lotion or pure coconut oil applied to the sole and heel works well. But never put moisturizer between your toes. That trapped moisture encourages fungal infection. Second, and this is important, if your heels are cracking deeply in summer, or if no moisturizer has made a dent after 2 or 3 weeks of consistent use, that's the moment to call your doctor. Because this isn't a skin problem, it's a nerve problem, and it deserves to be investigated. I want to stop here for just a moment. We're halfway through, and I want to ask you something directly. Have you recognized yourself in any of these signs? The tingling, the burning at night, the slow healing cuts, the discoloration around your ankles, the cracked heels that won't respond to anything? If the answer is yes, even to just one, I want you to go to the comments right now and type the word yes. Just that word. Capital letters if you want. That's all. Because I read every single comment on this channel, and your response tells me who I'm actually reaching. It tells me who needs this information most. And it might be the first time you've said out loud that something doesn't feel quite right. If you're finding this valuable, hit the like button now. It takes 1 second, and it tells YouTube to show this to more people over 60 who need to see it. Okay, let's keep going. Sign number 6, swelling in the feet and ankles that leaves sock marks. Almost everyone I speak to about this tells me the same thing first. They stand all day, or they sit at a desk too long, or it's just a hot day. And yes, occasional mild swelling from activity or heat is completely normal. But here's what changes the picture. If your feet and ankles are consistently swollen, if you take your socks off at the end of the day and the indentation stays in your skin, that's a different story. Here's the connection that most people never hear. High blood sugar affects the kidneys, and the kidneys control your body's fluid balance. When kidney function begins to be stressed by years of elevated glucose, fluid accumulates in the lowest part of your body. Gravity does the rest. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes. And lower extremity swelling, what doctors call edema, is frequently the first visible sign that kidney function is starting to be affected. When you rest, elevate your feet above the level of your heart. Even a few inches on a pillow helps pull that accumulated fluid back toward the center of your body. And reduce sodium in your diet. Salt causes your body to retain water, which makes swelling significantly worse. Read labels. Canned foods and anything processed are often loaded with hidden sodium. And if the swelling is new, getting worse, or happening in only one leg, please don't wait. Call your doctor that week. Sign number 7. Foot or leg pain that feels like stabbing or electric shocks. This is the sign that gets misdiagnosed more often than any other on this list. Almost universally, the patients who come to me with this pain have already been told it's arthritis, or an old sports injury, or just wear and tear from decades of living. And sometimes it is those things, but there's a specific quality to diabetic nerve pain that's different. And once you know it, you'll recognize it. It arrives without warning. It's often described as a stabbing sensation, an electric shock, or a hot needle being pushed through the foot. It's most intense at night when there are no other distractions, and it doesn't respond well to anti-inflammatory medications like ibuprofen because this isn't inflammation. It's a damaged nerve misfiring. Think of it like a car alarm that went off after a small fender bender and never stopped. Nobody is breaking into the car. The alarm is just broken. Your nerve is sending alarm signals to your brain when nothing harmful is actually happening. The pain is completely real, but the source is nerve dysfunction, not injury. A landmark study published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is frequently mistaken for arthritis or age-related joint pain. Every morning before you get out of bed, spend 5 minutes doing gentle foot and ankle stretches. Flex your feet, circle your ankles, pull your toes back slowly, and every night before sleep, give yourself a 3-minute gentle foot massage. Light circular strokes along the sole and up the ankle. It's not a cure, but it keeps blood moving through those nerve-dense areas and provides real relief. Sign number 8, feet that are cold all the time, even under blankets. There's a difference between running cold and running cold all the time. Most people know their body. They know if they've always had cold feet in winter or if this is something new. The sign I'm talking about is persistent coldness that doesn't respond to warmth. Cold in July. Cold under 3 blankets. Cold even when the rest of your body feels comfortable. That's a different kind of cold. And it points to something specific. When blood sugar damages blood vessels over time, those vessels narrow. They lose their flexibility. Warm blood simply cannot reach the tips of your feet in sufficient volume. Your circulatory system is trying to heat that far end of the house, but the pipes are too narrow to get the warmth there. The American Heart Association identifies peripheral artery disease, caused by exactly this kind of blood vessel narrowing, as affecting over 8 million Americans. Diabetes is the single largest risk factor, and cold feet are one of its most consistent early symptoms. The best thing you can do here is also the simplest. Walk every day. Not aggressively, not on a treadmill at maximum incline. Just walk. 30 minutes of purposeful walking forces circulation into the lower legs and feet. It strengthens the vessel walls over time, and research shows it can actually begin to reverse some of the early narrowing when done consistently. Start with 10 minutes if 30 feels like too much. The important thing is to start. Sign number 9, hair loss on the lower legs and tops of the feet. This is the one nobody talks about. I have never seen it covered in a patient brochure. Most people have never been told to look for it. And when I point it out during a foot examination, patients look down and say the same thing almost every time. I never noticed that. And that's exactly the problem. It's subtle. It's easy to overlook, but it matters. Here's why it happens. Hair follicles need a steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in the lower legs and feet gradually stop receiving what they need. Over time, they simply stop producing hair. The absence of hair growth on your lower legs or the tops of your feet is a visible marker of blood vessel damage that may have been progressing quietly for years. Research published in the journal Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in people with diabetes, and that it's a reliable, frequently overlooked sign that physicians are specifically trained to look for. Right after this video ends, look at your lower legs and the tops of your feet. Compare them to the rest of your leg. If the hair is significantly thinner in those areas or completely absent, schedule a blood glucose test this week. Not this month, this week. The test costs around $12 at most certified labs. Medicare covers it for most viewers watching this. $12. That's the investment. So, you've just seen 9 signs. 9 places your body has been trying to get your attention. And I want to be completely honest with you about something before we finish. Finding one of these signs doesn't mean you have diabetes. It means your body is asking you to pay closer attention, to have a conversation with your doctor, to get a simple blood test and know for certain rather than assume. Here's what I recommend you do in the next 48 hours. Tonight, sit down and look at your feet in good light. Look at the skin. Check the color around your ankles. Look between your toes. Feel for areas of numbness or unusual sensation. Check your lower legs for hair loss. This takes 3 minutes, just 3 minutes. If you recognize 2 or more of the signs we discussed today, call your doctor tomorrow morning. You don't need to wait for your scheduled annual checkup. You can call and say, I've been noticing some changes in my feet, and I'd like to get a fasting blood glucose test and an HbA1c. Those 2 words, HbA1c, get attention. That test measures your average blood sugar over the past 3 months. It tells a much fuller story than a single fasting reading. And while you're waiting for that appointment, start the habits we talked about today. Walk every morning. Reduce added sugar. Add more fiber to your meals. Drink enough water. Moisturize your feet every night. These aren't dramatic changes. They're small, consistent choices that add up to something significant over months. Because here's the truth I want to leave you with. Catching this early doesn't just mean avoiding diabetes. It means protecting your kidneys, your eyesight, your heart, your balance, and your independence. It means staying in your own home, driving your own car, living your own life the way you've worked your whole life to be able to live it. The information exists, the tests exist, the habits exist. The only thing that was missing was knowing what to look for. Now you know. Before you go, I have one small request. Think of one person in your life right now. A friend, a spouse, a sibling, an adult child who's been worried about a parent. Someone who might be ignoring changes in their feet because they don't know what those changes mean. Share this video with them. Right now, before you click away. Not tomorrow, now. Because you might be giving them something they didn't know they needed. You might be the reason they make a phone call they've been putting off. And that phone call might be the one that changes everything. If you haven't subscribed yet, please do. I post every Tuesday with the kind of honest, practical, research-backed health information that takes time to find and really shouldn't be this hard to access. Leave a comment below telling me which sign surprised you most, or tell me which one you recognized in yourself. I read every single one and I respond to as many as I can. This community matters to me. You matter to me. I'm Dr. Joseph Lee. Take care of those feet, and I'll see you next video.